Okay, so you've got your revision notes on postpartum baby blues right there. We're going to do a deep dive now, really zero in on the most crucial high-yield bits for you.
Exactly. Think of this as pulling out the absolute essentials. We want you to get what baby blues actually is, why it's important to spot it, and critically, how it's different from, say, postpartum depression.
Which is key because it's so common, right?
Yeah.
Understanding it well is definitely high yield for revision.
Absolutely. And the structure of the notes you have, it's actually a great roadmap for remembering this stuff. We'll follow that flow definition, cause us right through to management and prognosis.
Perfect. So kicking off with the definition,
Mm-hmm.
it's often just called postpartum blues.
Mm-hmm. And the timing is key here. It typically hits within that first week after the baby arrives. The core features you have to remember, well, it's mainly those mild mood swings and often quite noticeable tearfulness.
Right, tearfulness. And the notes are clear. This is seen as a normal physiological thing.
Yes, largely tied to those huge hormonal changes happening right after birth. The big drop in estrogen and progesterone.
Plus all the other stuff.
Hmm?
The emotional side of becoming a parent, the sleep deprivation.
Oh, definitely. Sleep deprivation is a massive factor. It all sort of mixes together physical changes, emotional load, lack of sleep, and impacts neurotransmitters.
It's not just one thing then. The notes point to risk factors too, don't they?
They do. Things like maybe having mood issues before, not having much social support, stressful life events happening around the same time, or even a difficult birth experience.
Hormonal shifts in sleep, though, they seem like the big ones flagged in the notes.
For sure. And the epidemiology, the numbers really back this up. In the UK, the notes say, what, up to 80%?
Yeah, up to 80% of new mothers might have some kind of mood disturbance. That number itself is a key takeaway. It's really common.
It really is. So when you look at the clinical features listed, it's that classic picture. Mood swings, being weepy, maybe feeling irritable, anxious, overwhelmed.
Fatigue, too, and trouble sleeping, even when the baby is asleep.
Exactly. It captures that sort of emotional roller coaster feeling.
Okay, now this next bit feels really important for revision, the differential diagnosis section.
Uh-huh. This is critical. The notes really stress knowing the difference between baby blues, which is generally mild, short-lived, and postpartum depression, or PPD.
PPD being more severe, lasting longer.
Precisely. And the timing, again, baby blues in that first week and the severity of symptoms are your main clues for telling them apart. You absolutely need to nail this distinction.
So if it is just baby blues, what about investigations?
Well, that's another key point from the notes. Usually you don't need specific tests.
No tests.
Not for straightforward baby blues. The diagnosis is clinical. It's based on those symptoms we talked about, appearing within that first week or so.
Okay, good to remember. No tests unless.
Unless the symptoms drag on or seem to be getting worse, that's when the notes say you must investigate further, primarily to rule out PPD or perhaps other mood or anxiety disorders.
Got it. So if tests aren't the focus initially, what is a management approach?
It's fundamentally supportive. The notes highlight reassurance, letting the mother know it's common and usually passes, providing good emotional support.
Education as well, for both parents.
Yes, educating them about it, suggesting coping strategies, getting family and friends involved can make a huge difference too.
Yeah.
Sometimes counseling or joining a support group is helpful.
And the prognosis. What do the notes say about the usual outcome?
Overwhelmingly positive generally. Symptoms usually peak around day 3 to 5 and then resolve on their own, typically within about 2 weeks. It's seen as normal, self-limiting. Complications are rare.
But there's that but, again, if symptoms don't resolve.
Right. The notes do caution that if it persists or worsens, it can affect the mother's well-being, her bonding with the baby. So while prognosis is good, monitoring is still important.
So keeping an eye on things is crucial to catch anything escalating into PPD, for example.
Exactly that. Prompt intervention if needed. So let's try and boil this down for revision. The absolute must-knows.
Okay. Baby blues. Very common. Maybe up to 80% feel something. Hits in the first week postpartum. Key signs. Mood swings, tearfulness. Usually mild, usually resolves within maybe 2 weeks.
And importantly, no specific tests needed initially. Management is all about support, reassurance, education.
And the most critical flag.
Knowing that symptoms lasting longer or getting worse needs further assessment. That's your trigger to think about PPD. If you grasp those points, you've really got the core of baby blues sorted from these notes.
Definitely. Okay, so here's something to think about. Building on that high prevalence figure you mentioned, that 80%, if mood disturbance is that common for new mothers, What does it suggest about the kind of support systems we actually need systemically during that whole postpartum period?
That's a really important question to consider. And just a reminder, as you carry on with your revision, check out resources like pastmsra.com.
And freesosray.com too. Keep digging into those notes and pulling out those high-yield facts.